I'm Dr. Ong. Nice to meet you.
Hello, I'm Victoria, and this is my daughter, Lily. Hello.
So what brings you here today? Tell me about what's been going on.
Lily, do you want to tell Dr. Ong, or do you want me to? Okay, well, recently our family and some teachers have begun to worry about Lily. Since the start of the school year, she's had trouble paying attention in class and her grades have been slipping.
What about Lily's extracurriculars? Do you play any sports or are you members of any clubs?
I used to run track and I was in service clubs, but then I didn't want to.
Why? What changed?
They told me it was stupid, so I stopped.
That's the other reason we are here today. A teacher called us a few weeks ago and informed us that Lily has been talking to herself in class, so much that she is no longer focused on the lesson, and she's making her classmates feel uncomfortable.
Have you noticed this occurring at home?
I hadn't really noticed her talking to herself, but sometimes what she said wouldn't make any sense. She has also become very insistent that her classmates are trying to make her sick, which doesn't make any sense because her teachers say that everyone has been healthy.
Well, it's important that you've noticed these things and you are right to seek help. Do you mind if I talk to Lily alone?
Lily, is that okay?
Okay, maybe yes.
So Lily, I was wondering if you could tell me a little bit about the people you talk to in class, the ones your teacher was telling your mom about?
They're my friends. I can only hear their voices and they get mad when I don't talk back to them. They're loud and sometimes I don't like it.
Do these voices, your friends, ever tell you to do anything?
Yeah, it's nothing bad. They told me to pull my little sister's hair, and she got mad, but she was okay. And they always tell me to hide things from my mom. Like last week I hid her shoes under the couch, and it was really funny.
Do you always do what the voices tell you to do?
Yeah, I mean, they're my friends.
Thank you for sharing. Now I want to revisit what your mom said about your classmates trying to make you sick. What's going on with that?
They keep trying to make me sick. I know they are. I can tell that they're planning it. They're all in on it, and I'm going to end up dead.
Why do you think this is happening?
I see them talking about it. I know what they're doing.
But does that necessarily mean they're trying to hurt you?
Of course it does.
I see. Well, if you don't mind, I'd like to bring your mother back in here. Is that okay, Lily?
Yeah, that's fine.
Please have a seat.
So, what do you think is happening with Lily? Is she going to be okay?
Short answer is yes. Lily is telling me about the voices she hears and her classmates' attempts to make her sick. Those voices are auditory illusions, and along with those, Lily is experiencing what we call delusions or false beliefs. I've also noticed that her speech is slightly disorganized, which mirrors disorganized thoughts. Now, you say that these symptoms have started since the beginning of the year. Is that correct?
Yes, but the delusions and hallucinations have only been happening for a month.
That's what I suspected. Since these symptoms have been happening for at least 6 months, with 1 month of acute symptoms, I feel that it's just to diagnose her with Hebephrenic Schizophrenia.
I'm not really sure what that is.
It's more commonly referred to as disorganized schizophrenia. This explains her lack of motivation in school, her delusions, and her auditory hallucinations.
Well, can she be treated? Isn't schizophrenia a horrible disease?
Not necessarily. Often, schizophrenic patients do not become violent, and luckily, since this has developed quickly, treatment will be easier with more results.
I didn't know anything was wrong with me, but will I be okay?
Yes. For treatment, I recommend weekly therapy sessions so we can keep track of how you're feeling. We are also going to put you on chlorazil, which is a fairly strong antipsychotic.
Fairly strong? What are the side effects?
Your white blood cell count may decrease, so you'll have to get blood tests every 2 weeks to keep that monitored, but they're very safe. We will also be implementing cognitive therapy sessions.
What is that?
In short, we will be changing the way you think about situations. This means that I want you to start watching your emotional reasoning. Basically, your feelings only make you a person with feelings. Additionally, I want you to try and recognize that overgeneralization is illogically incorrect. For example, think about what you said about your classmates trying to make you sick. Are they all out to get you, or do they even have a problem with you at all? Lily, how have things been? Give me an update on the past few weeks.
I'm good.
Things are getting better. Lily's grades have started to improve, and we've had fewer instances of her hallucinations and lack of focus.
That's really good. When did you start to notice these changes, Lily?
I started to feel a lot calmer about 6 weeks ago, and I don't hear the voices that much anymore. So I feel more in control of my actions. Then my worries about my classmates started to go away too. It's so nice to feel like myself again and not have constant distractions.
About 6 weeks after starting her medication, Lily started to seem a lot better. She seems like she is more focused when I talk to her, and her behavior has gotten better. I think that's due to her either not listening to the voices or just not hearing them at all.
It's probably both. If not now, Lily should stop hearing the voices soon. Chlorozole takes about 4 to 8 weeks to become fully effective. If it hasn't kicked in yet, then the cognitive therapy might help Lily ignore the demands of the voices. But I want to know how your day-to-day life has changed, Lily. Have you started doing more social things and extracurriculars?
Yeah, I'm back on the track team and have been joining clubs. It's a lot of fun and I'm happy to be able to go back to having a normal life and not to have to worry about my mental health as much.
I agree. It's a relief for Lily and our entire family. She'll be able to prepare better for her future now that she's healthy again. And it's really nice to see her happy.
That's great to hear. I'm so glad you guys have found so many successes through her treatment. Lily, in order to make sure you stay like this, you need to make sure to take your medicine daily and be sure to get regularly checked to ensure that you're not getting any of the side effects. The biggest problem with schizophrenics is them not taking their medication and backtracking to where they were before. You've made so much progress and we don't want to jeopardize you losing that.
Our family, along with her teachers, have tried to create a very supportive environment for Lily.
That's great to hear. Lily, how has the cognitive therapy helped?
I think it's working. I have tried to remove myself from situations so that I can take more control over things, but it's a difficult task.
How so?
Sometimes I feel like the paranoid thoughts I'm having are rational. Even when I try to change my perspective, I only realize that I'm being irrational when someone else tells me or notices it. Or else I would have no idea. It's frustrating because even though the other things are working so easily and well, cognitive therapy is sometimes something that I have to work for, and it takes a lot of patience.
That is because when you have delusions, your illogical beliefs are so strong that they become your reality.
Will that ever go away?
The more severe side effects of disorganized schizophrenia will go away with the antipsychotic, but you have to understand that this is a disorder that will affect you for the rest of your life. But this disorder affects many people, so you're not alone. There are lots of people who are in the same situation that you are and are there to offer support. Things will get better, and they look like they already have.
Thank you so much for helping our family. Now I know I can be sure that Lily will be able to live as normal as a life as possible.